Imagine waking up, but not truly being awake. Your body moves, but the commands aren't your own. Something else is pulling the strings, a parasite deep within your brain. This isn't science fiction, it's a chilling reality in nature. Zombie parasites, organisms that hijack their hosts' minds. These parasites have evolved to manipulate, rewriting instincts and driving their hosts toward a fatal destiny. The host's life becomes a tool for the parasite's survival, its identity overwritten. Parasites release chemicals that alter brain function, compelling obedience, a biological reprogramming. If they can control insects and mammals, what's stopping them from targeting us? Nature's innovations know no boundaries. The story of zombie parasites is a warning. The line between species is thinner than we think. In the rainforest, the fungus Ophiocordyceps unilateralis turns carpenter ants into zombies. A spore infects an ant, grows inside and waits, then seizes control, forcing the ant to climb to a precise height. The ant, compelled by chemicals, bites onto a leaf in a death grip. The fungus kills it, then sprouts from its head, releasing spores to infect others. Another master manipulator is Toxoplasma gondii. It infects rodents, rewiring their brains to lose fear of cats. Infected rodents are drawn to cat scent, making them easy prey, completing the parasite's life cycle. These are not isolated cases. Nature is full of parasites that control behavior with terrifying precision. Each example is a glimpse into evolution's dark ingenuity. The question is, how far can this manipulation go? Parasites and hosts are locked in an evolutionary arms race, but boundaries between species aren't absolute. Climate change and habitat destruction are bringing parasites into contact with new hosts, including us. As parasites adapt, each new host is a stepping stone, increasing the risk of a jump to humans. Toxoplasma gondii already infects millions of people, often without symptoms. But it may subtly influence human behavior, risk-taking, mood, even social patterns. Our changing world is a laboratory for evolution, accelerating the chances of a parasite adapting to humans. International travel could spread a new mind-altering parasite globally before we even detect it. The leap from animal to human is not just possible. It may already be happening. The threat is real, and we're only beginning to understand its scope. Imagine a new mind-altering parasite quietly spreading among humans. Early symptoms are mild, irritability, risk-taking, social changes, easily dismissed. The parasite manipulates behavior to aid its own transmission, making detection nearly impossible. As it spreads, subtle shifts become widespread. Communities grow lethargic, compliant, or dangerously aggressive. This isn't a zombie apocalypse, but a slow erosion of rational thought and social cohesion. By the time we recognize the pattern, the parasite could be deeply entrenched. Tracking a disease that spreads through behavior, not just biology, would be a public health nightmare. The true danger isn't monsters, it's losing control over our own minds. Stopping a mind-controlling parasite would demand rapid scientific action. We'd need new diagnostic tools to detect behavioral and neurological changes, not just physical symptoms. Treating parasites is tough. They're similar to us at the cellular level, making drug development challenging. A drug that targets the brain infection without harming patients would be a breakthrough. Ultimately, a vaccine could offer protection, but developing one requires deep understanding of the parasite's biology. Investing in parasitology and global surveillance is essential. These threats are real, not just fiction. By studying nature's puppet masters, we can prepare for the threats they pose and cut their strings before they reach us.